Welcome back to Mountain Connections on this Health and Wellness Thursday. We are going to talk about an aspect of health that sometimes isn't discussed very much, and that is HPV and the unfortunate information that has been learned that HPV can cause certain types of cancer. Had an interesting discussion recently all about this. Let's take a look.
Right now, we are going to discuss more about HPV and the link to certain cancers and diseases in advance of this year's International HPV Awareness Day. Here to tell us more is Dr. Perry Ghodsi, a practicing board-certified obstetrician gynecologist. Dr. Ghodsi, thanks for joining us here on Park City Television.
Hi, thank you for having me.
So define HPV and how common is it?
So HPV, otherwise known as human papillomavirus, is a sexually transmitted infection, and it's one of the most common sexually transmitted infections. About 85% of people that are sexually active at any point in their lifetime will become infected with HPV. Now, it's important for everyone to understand that the majority of people that are infected with HPV will clear the virus without any problems. But unfortunately, a portion of those people will go on to develop an HPV-related cancer. And we don't know why is it that some people go on to develop these HPV-related cancers and some people clear the virus.
Who is most at risk here?
So anyone that is sexually active at any point in their life is at risk for HPV. It does not matter your sexual orientation, your gender, or your age.
And what would you like viewers to know about HPV, and really, what do they need to know?
So what I really want to stress to people is A, how common it is. What we talked about, that 85% of the population will become infected with HPV at some point in their lifetime. So you can see just how common it is. And what I also really want people to know is there is a link between HPV and HPV-related cancers. And we don't know why it is that some people will clear the virus and some people will go on to develop an HPV-related cancer. I also really encourage people to start having conversations about HPV, to be proactive about their health, to take ownership about their health and their education regarding HPV. And the first thing you can do to do that is to talk to your doctor. Start talking to your doctor about HPV and HPV-related cancers to find out what screening is best available for you and just to learn more about it.
What types of cancer can HPV cause, and how common are they?
So there are a myriad of HPV-related cancers, and overall there are about 35,000 cases of HPV-related cancers in the United States per year. The one that I am most familiar with and most comfortable talking about as an OBGYN is cervical cancer, and there are about 12,000 cases of cervical cancer per year in the United States.
And how can we screen for HPV-related cancers?
So regarding cervical cancer, there's a very common screening test, which many people are familiar with, which is the Pap Smear. And so what the Pap Smear does is your doctor will take samples of cells from your cervix and send it to the lab to look for any abnormalities that may later lead to cervical cancer. Your doctor at the same time or separately can also screen you from HPV from your cervix by taking cells and sending it to the lab to look for the presence of HPV on your cervix. Now, unfortunately for men, there isn't routine screening right now for HPV, but I still encourage everybody to talk to their healthcare provider about HPV, the link to HPV-related cancers, and what's best for them.
Well, thank you so much. Where can we get more information?
So number one, talk to your doctor. Number two, please go to hpvcancerstories.com. There you can learn more about HPV. It's linked to HPV-related cancers, and you can also hear some personal stories about how HPV has affected people.
Well, thank you so much, Dr. Perry Ghodsi, for joining us today for this important conversation about HPV.
Thank you so much for having me and giving me the opportunity to speak.